Hi, welcome to the Recovery Roundup, our monthly exploration of sobriety, community, and well-being. My name is Carrie Dury. I am the Director of Business Development here at Calvary Healing Center. And on this month's episode, I am joined by Danny Blanco. He is our new Director of Nursing here at Calvary. So thanks, Danny, for joining.
Oh yeah, absolutely. Thanks for having me. How exciting.
I know you're very busy today, and as always, so we can cut right to the chase and get a little bit of info from you. For those that don't know, like I had mentioned, Danny is our new Director of Nursing. So he is how many? A couple months now?
I'm going on 3 whole months, so almost 90 days.
3 whole months.
I'm brand spanking new, so they say.
You are. So I would love for you to give us a little bit of background about yourself.
Sure.
And what drew you over to joining our team here at Calvary?
Yeah, absolutely. So I'm a registered nurse, obviously. I've been a nurse for a little over 20 years, a little long in the tooth in that area. My background is ICU, intensive care, trauma, and ER and trauma ICU. That's how I've spent the majority of my time. I've been in leadership for the last 18 years, whether it be as a charge nurse or a manager, an educator, director or senior director, or a chief nursing officer. So yeah, I've had quite a spell in leadership and nursing. I think with working in the ER, particularly what's drawn me to serve in this population is just witnessing how our community is really underserved. So working in an ER, we have individuals that are seeking treatment for their addictions and or a mental illness, and we don't do right by them. We don't provide the services that are necessary to aid in their recovery. And we can do better. So when I got the call to come and work for Calvary, I was very excited about it, a little nervous because I had never worked in a recovery or chemical dependency treatment center before. But with my background and my passion to help people, I thought, why not? And I'm very glad that I did. It's been a wonderful almost 3 months, and I hope it's gonna go for a long time hereafter.
I couldn't agree more, coming from a variety of different places in the behavioral health field, but then also identifying this need specifically with this particular population. And you nailed it. I mean, the underserved group here, and I know it's throughout the country, but I don't know. I think here, you more than me on the front lines, seeing it every day. There's only so much you can probably tackle in the emergency room,
Correct. Yeah,
so
that is true.
Yeah,
that is true. And there's and there's so much, and to see individuals who are suffering, who are staying in our emergency department for sometimes days, sometimes weeks, and even months, who are waiting for placement in a more appropriate venue so they can get the treatment they need, really is hard to witness. So it's nice to be in a place where people can get the help that they're seeking right away.
Exactly. So in your short time with us so far, and we're thrilled to have you on board, but I know it's been only a couple months. And I don't know if there's a typical day in the life of a nurse at Calvary Healing Center. That's one of the beauties of the job, that I don't know if any day really looks the same for us. Would you walk us through that? For those that don't know, we are 24/7 nursing, around the clock care. So we have our medical detox component with our nurses over there, and then we also have nurses on our residential unit. So that even looks different. So if you want to break it down, a typical, and again, I'm going to use that term very loosely, a typical shift for one of our nurses here at Calvary.
Sure. So you're right. Every day is different.
Yes.
Every shift is different. So But I think a typical day for a nurse coming in, and we'll just kind of start with a day shift, is to come in and get reports on the unit that he or she is assigned to, whether that be our residential side or our detox side, get an understanding of anything new or any new patients that have come in, and then begin their day. So the nurse is responsible for the overall well-being of the patient, responsible for the med management, responsible for any physical ailments that are presenting, really doing a kind of a good assessment, and not interfering with what the patient is here to do, which is to program, right, to seek that therapeutic help. The nurses do their assessments in the morning, usually right off the bat, anywhere between 8 and 10, interact with our patients, make sure that their meds are being delivered on time. But it goes a lot deeper than that. Our nurses on a daily basis are interacting with our patients, assessing their anxiety level, assessing their depression level, where they are in this recovery journey, and then making recommendations to our clinical team of therapists and counselors, and working with them so that we have a better outcome. Nurses are also responsible for responding on any variety of emergency that can happen within our unit. Because we do have a detox side, there are physical dangers that can be associated with that, and it's up to the nurse to manage those and to head those things off in the beginning and not allow them to escalate. So it takes a lot of skill. I'm very proud of the nurses that are here. To coming from an emergency department and going very quick paced and dealing with one emergency versus another. The nurses here are heading off emergencies before they begin. And that takes a lot of skill to do, to recognize danger zones and not allow them to progress to a full-blown emergency where the patients have to go to a higher level of care, but can stay and work on what they've come to us to work on.
You're exactly right. That's a great way of phrasing it too. They are sensing, things that maybe I wouldn't, or, just other nurses in other industries may not be as really perceptive to. I think that lends me to, another really good point. And we were talking about this earlier about how our staff, so many of them, but including our nurses and behavioral health technicians that have experienced recovery in their own life in one way or another, personally, individually, or, family and friends, that makes them identify some of those, I don't know if you want to call them triggers or just environmental things, changes, shifts that they're able to pick up on that maybe, again, I don't know where else that would happen.
Right. Yeah. I would say that a majority of our nursing staff, and when I speak of nursing, I'm also talking not only about our RNs, our LVNs, I'm also speaking of our behavioral health techs, who are amazing men and women that you'll see out usually in the black scrubs, meandering through our milieu, having the really face-to-face interactions with our clients. So when I speak of nursing, I'm speaking of them as well. I think a very large majority of our staff are either in recovery themselves or have been touched by addiction in one way, shape, or another, whether it be through a loved one, a spouse, family member, or a sincere friend. So they bring a very unique understanding to the problem of addiction and to the illness of addiction, probably more so than someone who hasn't been touched by that would understand. They can sense when someone's anxiety is high, and they can work on preventing those triggers from happening that is going to prevent someone from, really working on their own recovery.
Right. Yep. I think that's what makes Calvary's team, nursing team, unique. Right. I know you've also been pushing and trying to incorporate a couple of other things that in my time at Calvary have not been the case. So do you want to share a little bit about some of the new, I don't want to call it programming, but kind of the new, the new forefront?
Sure, no, yeah, programming. So pretty exciting. Our nurses, when I got here 2 months ago, you just try to learn the role, learn the environment, learn the culture. I was very happy that the culture here is one of patient-centered care, very positive. So that was just a pleasant surprise going into any new position to find that. One of the things though that I kind of thought early on, well, really as a nurse, you can offer so much more than simply handing a med or doing an assignment or an assessment or bandaging a wound. You can help take care of that mental health need that those clients would have. So our nurses are now participating in running some small groups, some therapy groups, whether it be meditation, they are leading that, some art therapy, taking our patients, which is a very new thing and it's actually starting today, to the gym and giving some pointers on workout techniques. And then we have a nurse who actually comes in on Saturdays and leads some of our clients on a nature hike. So bright and early on Saturday morning. And it's a great way for nurses to connect with our clients who are here and have a better understanding of what their needs are on a daily basis.
Exactly. Yeah. And like I said, that, a lot of that integration with our teams from our therapists and the work they're doing, also coupled with the fact that our nurses are supporting a lot of those ideas and interventions as well on the unit to really kind of just mold those two things together. Because, right, physically speaking, obviously our nursing team is spot on and is fully aware, but they have some more, in the offering department to get on board and integrate some of that care. I think it's fantastic.
Yeah, I agree. I'm very excited that those programs are happening, and a huge shout out to our clinical team led by our clinical director, who's providing guidance and direction to our nursing staff to make sure that we're doing it right. So it's definitely a team effort.
Sure, absolutely. Well, I know, like I said, I know you're very busy and you guys are going all over the place. So I don't want to take up too much more of your time, but I do thank you for joining for a couple minutes this afternoon. And I know we will be talking more maybe on a future episode if time allows. So
you know where to find me.
Thank you again, Danny. We really appreciate you, Absolutely. The nursing team at Calvary. We would not be the place that we are without you guys.
Thank you.
100%, team effort, but so much of what you guys do is contingent really on whether or not our patients are going to be successful in getting those skills once they leave our building. So anyway, thank you so much.
Oh yeah, you're welcome.
I'll let you go.
Okay.
And thank you everyone for joining on this episode of the Recovery Roundup. We will see you next time. Bye.
Bye.